Hello, everyone. Today we're going to talk about health literacy and patient education. Let me share my slideshow with you here. All right, so with health literacy and patient education, it's not particularly talking about what we're sharing, but how we're sharing it, and also assessing our patient to see how much they already know and where we can kind of meet them at the point of what information they need to know. So ideally, we want the patient to be able to have health information and understand it in language that is understandable to them and in a way that makes sense, right? So we want to make sure that we are giving them the most accurate information in the most timely manner. If our patient has a new diagnosis of diabetes, there is 100 things probably that we need to teach them if we start from ground zero. But not all of our patients need to be educated from ground zero. Some of them may have a history of understanding about their diet or about medications or about exercise. So asking them questions about what they know and the things they need to know helps us to be able to start at that point. There's a case study that's on page 192, and I'm going to be referring to a couple of slides with a case study, but I want you to take a look at that. And it says health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information. We can think about today's really environment and think about how do we learn about new things that have to do with health and health information. We may see commercials on TV about medications. We may have education in some type of a health related field, right? So if you're talking to me about my blood pressure, I have a basic understanding about what blood pressure is. We may have taken care of a family member that has had a similar type of disorder. I want you also to think about the things that are necessary for you to be able to understand what I'm saying. So we have to be able to understand the same language, right? We have to be able to decipher whether that patient understands things best if I talk to them about it, if I give them a handout, or if they practice something with their own hands. So it's going to depend on, is it a skill that they need to practice with their own hands? So if they're going to check their blood glucose and they're going to go home and perform that skill, we would want them to perform that skill in front of us so they feel confident in doing that and we can observe that they're doing it correctly and safely. We're going to talk about that. Preferably, we want to educate patients in a multimodal manner. Multimodal means multiple modes of learning. And so we are going to want to talk to them about information. We're going to want to give them handouts so that they can go home and review what we've talked about. And then for many things that we'll talk about and teach, we'll want to see them do that in front of us or demonstrate that. Basic health information has more to do with learning about disease processes and medications. It also has to do with understanding what is health. So do I understand about my lab work? Do I understand about why I'm getting a certain test? Do I understand about if you say that my arteries to my heart are blocked, what does that mean? Where are my arteries? What do they do? So sometimes it's about a little A&P and then talking about what are the consequences of that? We also think about health information being much broader. So thinking about access to care. Do I have a primary care doctor? Do I know when to go there? Do I have health insurance? Do I understand what my health insurance covers? Do I know who to ask for help out in the community? So do I call my doctor or do I call the hospital back if I have questions? So it's really very broad when we talk about health information. We want them to have information to make appropriate and informed healthcare decisions. So one of the things we talked about is if we don't speak the same language, then we need to get an interpreter, right? So we want them to feel comfortable and confident and understanding that what we are saying, they're truly interpreting, and vice versa. We want to feel confident that what the patient is saying and responding to what we've taught, that we understand what they're saying. This can vary between people's backgrounds. So if we can think about patients' age, their cultural backgrounds, their language, we can think about it being someone that is hearing impaired, someone that has problems with vision, someone that we have to determine if they can read and write, if they have a primary care doctor. So a lot of those questions we're going to ask to help us kind of meet the patient where they are at that point. Again, their abilities could be the ability for them to process and understand information, that we're talking to them at a level they can understand, and the means. Are they able to afford their medications? Do they have transportation to the doctor? Do they feel confident in their ability to perform the skills that we've talked about? So the role of the nurse in health literacy is health promotion. I want to know the things that I need to do to stay healthy while I'm still healthy. So we want to teach them about immunizations, healthy diets, how to know if my chronic disease of respiratory asthma is, if I am good based on my symptoms, if I need to see the doctor based on my symptoms, or if it is emergent based on my symptoms, and how to stay healthy. We also want to talk about instructions. So there could be step-by-step instructions, how to check your blood sugar, how to check your blood pressure, how to interpret lab results, how to change a dressing, okay? And then coping as well. So we know that all of these things that have to do with health, whether health promotion and staying healthy, changing our lifestyle, so diet, exercise, medications, or treatments for illnesses, can be can be a lot to understand. It can be overwhelming. And so asking patients how they're doing, how they feel, how confident do they feel, those things will help us to be able to assess, are there any needs they have when they go home? Do they need us to call and follow up if we work in a physician's office? Do they need home health to be consulted? Do they need referral to an outpatient nutritionist to follow up with their diet? We each have different health disparities, and disparities we can think about as being information that we don't understand. It can be questions we have about how to access care. Okay, so I have a primary care doctor, and now you want me to follow up with a cardiologist. Why do I need a cardiologist? Why can't I just go to the same doctor that I know? So why do I have to find another doctor? And why should I be compliant? So compliance means that I'm following the instructions as they've been outlined. And we know that all of the time that patients aren't non-compliant because they don't care. It's because they don't understand. It's because they're having difficulty coping, that it's overwhelming, all of the things they have to do. Or it is that there is simply gaps in information that you assume I know that I really don't. So how do we create an encouraging, supportive environment where people feel it's safe to say, I don't understand that? So how do we know what types of things are health promotion activities, or what type of goals that we should be working forward with our patients? I want to introduce you to Healthy People 2030. And this is a link on the screen here that is a national, well, truly a worldwide initiative that is looking forward at the next 10 years to be able to look at each age group and special type of patient population, whether it be middle schoolers, whether it be newborns, whether it be patients that have heart disease, patients that are having difficulty accessing medications and care, And it's got a lot of initiatives in there that say, what are the worldwide initiatives as we see them, and what are the problems that our nation and our world is having regarding staying healthy, and understanding about what it is to be healthy. So what's great about Healthy People 2030, we just finished Healthy People 2020, is that I'd like you to click on a lot of those and see what are the problems, but then as well, what is the data, what's the statistics for those kind of problems, and what are the interventions that can help people. Those can help us to really understand what are some of the health issues out in the community, not just when people get acutely ill in a hospital. So the role of health literacy in nursing, expected patient competencies. These are things we take for granted. And let's look at some of those. So reading and identifying credible health information. Patients many times hear very conflicting information about health. They maybe get information from television programs, television commercials, newspaper articles, magazines, the things that they're hearing from the physician's office, the things they're hearing from their friends and relatives, and a lot of things they're reading on the internet. So how do I know the information that I should really believe? What are the sources I should go to for health information? So in addition to talking about diabetes and healthcare and heart disease and immunizations, there are websites and that we recommend for patients to be able to find credible health information by some of our national leaders in healthcare. These are things like the World Health Organization, the National Institute of Health, the Center for Disease Control and Prevention, Healthy People 2030. What I like to say is any website that ends in edu for education or in gov for government are what we consider credible health information sites. We've got to understand the numbers in context to our health. So if I simply tell you that you need to check your blood sugar or your blood glucose or your blood pressure, and you don't know what those numbers mean, is that a good number? Is that a bad number? Is that something I need to tell my doctor about? So along with how to do the skill, what does the information mean, and what should I be doing with that information? Think about lab work. So patients get a printout, or they can look up on their physician website about getting their lab information. What does that mean? How to make appointments. Okay, we know a lot of offices for making appointments have gone virtual, online. So how are the ways that I can make appointments? How to fill out forms? What you will see sometimes is in a physician's office or clinic that the receptionist at the desk or the office assistant at the desk will hand a patient forms to fill out. And if you see someone sitting there and they're continually looking at those forms and they don't complete them, we need to figure out why. Many times it's that they don't understand the information or they can't read and write. So we always want to ask people if they need help filling out the information. On our admission to physicians' offices and hospitals, we should be asking patients if they are able to read and write, and what language is their primary language they use to read and write. We need to gather health records and ask appropriate questions of physicians. The more information that we can provide patients about their health and how to interpret information about their health, the more likely they are to be able to understand it and think a step further to ask about questions they don't understand. How to advocate for appropriate care. So how to ask questions about their health care and also be able to take that a step further and say, I don't feel like I'm getting what I need to get, or maybe I need a referral, or I don't think this medication is working, or what does this lab mean? Is it better or worse than it was last time? They also need to know how to navigate insurance programs. In a physician's office or clinic, if there are things that we don't understand, there's always a billing person that we can contact. And in hospitals, there's always a case manager or, again, a billing representative, account representative that can speak with patients. Using technology to access information, again, how comfortable and how confident do they feel with technology? Do they know how to navigate it? Do they have access to the internet? Lots of people don't. So the types of education. Education is presented in a wide variety of ways, and we're going to be practicing some of that. It can be formal, so I'm going to sit down, I'm going to give you information, we're going to talk about this disease process, but it can also be informal, me coming in, giving your medications, and presenting you with information about what it is and why you're taking that. Teaching is imparted or passed on to someone through knowledge and through giving instruction. And then the learning is taking that information that we're teaching and taking that in and using it to build on the knowledge we have or build on the skills that we have. So we're building on some knowledge that the patient may already have. And if we don't assess what they already know and the questions they have, we could be missing a huge gap there of the things that the patient truly needs to know. So let's look at this case study. We have a patient who is 55. She's an immigrant and she's overweight and concerned about her health. So she has some concerns about her health. She's come for her yearly physical. Ashley is a 23-year-old nursing student assigned to care for this patient. During their first visit, the patient says, I'm interested in getting some health information to help me become healthier and lose some weight. What are her learning needs? So first, what I would take from this is, tell me more about becoming healthier. What are the aspects of your life that you feel aren't healthy? I want to get her perception of health. Is it weight? Is it not feeling good? Is it not knowing what kind of groceries to buy to eat the right foods? And then losing weight. We want to make sure we're equating healthy ways to lose weight and to make that part of someone's lifestyle, not just losing weight quickly and equating weight loss to health, okay? So types of patient education, and I put this example in here just showing you a group of information. And for this particular patient, it says sick day guidelines for people with diabetes. There's a lot of information here. So if we simply just read this off and told someone this when they got home, or in particular, when they were sick, they may forget all of these things. So printing this out in a handout that we have at our facility will enable that patient to have it in hand when we're talking about it, and also maybe to make some notes on there and to take it home and kind of put it up on the fridge, because they'll need to refer back to this information again. So a lot of information will be printed off from our facility. Most facilities have a certain place they want us to get teaching information from. And the reason for this is that the teaching information that comes from these credible sites is written at a 5th grade level or less. So this is assuming that the health literacy of our patients is at about the baseline of the United States, which is truly health information at about a 5th grade level. We want the language to be understandable. We want to define terms they don't understand. And we want them to be able to have it in hand, to take it home with them, to have it so they get home, they look at it, and they can kind of pin it up on the fridge or put it in a safe place to refer back on it. So how do people learn? The cognitive domain is thinking about how I think about health information. So the knowledge I have, the material that I have, and that when we think about the cognitive domain, when we evaluate that type of learning, is for patients to say, I can state that these are the numbers or the parameter of numbers that are within normal limits for checking my blood glucose. These are the numbers that are within normal limits for checking my blood sugar. This is the information I need to know step by step to know how to prevent an infection and how to identify if I have an infection and when to call the doctor. So it's truly knowledge that the patient can state back to us based on what we've taught them. The psychomotor domain, so psychomotor is understanding the information well enough to perform a skill. And so it's learning that incorporates physical movement and the use of motor skills. So let's say that we talked about the steps to checking blood glucose. In the cognitive domain, when we assess, do they understand that information, we can say, can you state back the steps that you're going to take in preparing to check your blood sugar? The patient may say, well, it's important that I have the supplies. So I have alcohol swabs to clean off the area. I have the correct syringe. I have the correct insulin that I've verified. And I've looked on the instructions from my physician to say I know the correct amount of insulin that I'm going to administer. Great. The psychomotor domain is where they say, okay, I have all of that information and I understand what I'm supposed to have. Now I'm going to demonstrate to you how I draw up the insulin, how I check the insulin in the syringe to make sure it's the correct amount, and I'm going to show you how I'm going to clean the area of the site and inject the insulin, right? So knowing the knowledge and saying the knowledge, and then knowing the knowledge and demonstrating the knowledge are two different aspects of learning. And then the third one is affective domain. And affective, I think about, is my perception or how I feel about it. So it's learning that recognizes the emotional component. So do we have an emotional component that has to do with knowledge? Well, definitely. How confident do you feel? How, let's see, other than confident, how much do you say that you value information or that you are ready to take the next steps to performing the skill after watching me perform it? So it's about your ideas about how confident you feel. So the patient may say, now after we've talked about the information that you've taught me and I've performed it in front of you, I feel much more confident about going home and doing the same skills that we just did when I'm by myself. So that's me evaluating that, how they feel about performing the skill. It could also be us talking about how important it is that the patient check their glucose every day so that they make sure that they can really evaluate whether they are eating the right things and doing the right type of exercise. So I say, if you check your glucose let's say the physician said every day, if you check your glucose every day, then you'll be able to identify if there's a problem at the very beginning when the problem occurs, instead of waiting a week when you could have a problem with your health. And so the patient may say, oh, I understand that. I understand that it's important and that I do value checking my glucose every day like the physician has said. So I'm talking to the patient about how much they understand the importance of something. So how do people learn? Some people may say, well, I'm a visual learner, so I like to see things. I like pictures. I like to read things. Other people may say, I like to hear things. I want you to tell me that. I like to listen to recordings of things, and that helps me to learn. Other people may say, that's fine, but I like to do things. I like to demonstrate. I like to do things with my hands. Research has shown that if we can teach patients and they can demonstrate in all of those styles, then patients are more likely to be able to perform a skill successfully and to be able to have their questions answered, because we can find out more about how they do perform a skill, how they feel about a skill, and how they interpret the information we've taught them. So multimodal truly means that the patient's learning is facilitated when we use more than one of those methods: verbal, auditory, hands-on. And if we use more of those in our teaching instead of just one, patients are more likely to be successful in performing the skills when we're not with them. In this picture, we can see that we are watching the patient successfully perform and then use of incentive spirometer. So they're going to take big, deep breaths on that, and it's going to raise the meter, and it helps them to expand their lungs so they can take big, deep breaths in the hospital to avoid getting pneumonia. So it looks like this nurse tech has, the nurse has instructed them on how to perform the skill, and now the patient is demonstrating that skill. We could also ask them afterwards, how confident do you feel in performing that skill and understanding the information that we've talked about? So let's talk about some diversity considerations. What makes each of us different in the way that we understand information, and the way that we are able to comprehend and remember that information for a later time? It could be based on our age, right? If I'm going to teach a 5-year-old about the importance and the skill of washing your hands versus a 20-year-old college student versus a 50-year-old busy working person. We want them all to understand how to wash their hands correctly and the correct way to demonstrate that. But we know that talking about why it's important, right, could be different. Also talking about consequences of what happens when you don't wash your hands correctly, maybe in different language for each one of those patients based on their age, right? So I would say maybe for the 5-year-old, we could say, we can't see germs on our hands, but we know those are things that can make us sick. So we have to wash them away in the sink. And we're going to sing the happy birthday song while we do it to make sure all those germs are washed down the sink. So let's do that together. For the 20-year-old, we may say, what is important to a 20-year-old, right? Hanging out with friends, going to social events, going to sports. And so we could say, we want to make sure that you don't get sick. So washing your hands is a great way. I know that in school, you're touching lots of surfaces, doorknobs, you're touching lots of light switches, all those things on campus and in your dorm. And we don't want to bring those germs in from other places into your dorm room. So make sure you wash your hands, because you don't want to get sick and not be able to go to sporting events, play sports, miss class and have to make up all that work, or not be able to hang out with your friends. And it feels awful when you get sick. Maybe to our busy working parent, we may say, I know you're busy. You don't have time to be sick, right? So it's important that we wash our hands, and we teach our kids to wash their hands too, because if you're sick, you can't take care of other people. If your kids are sick, then you have to stay home, and you're missing out on all those important things that you're doing, like caring for your family, being able to attend your child's sporting events. You might pass that illness on to other people, and you're going to miss work days. So let's do what we can to stay healthy before we get sick, right? So we're taking into consideration what the understanding about consequences is and why it might be important to that age group person. So we are taking all those things into consideration in talking about what's important and how we perform it. We also need to assess an adult's reading level. Again, talking about appropriate sites to get information can help patients to be able to go to those sites, the edu and gov.sites, that has information that's written at a 5th grade level or less. We also want to know what they read as well, their reading level. Do they understand the handouts that we're giving them? Is there any terminology, any words in those handouts that you don't understand, or words that I've used to describe your illness or how you're going to be caring for yourself that you don't understand? Can you tell me back in your own words what we've talked about what types of foods you're going to be making to decrease your salt intake, about the things that we've talked about on reading a food label. Think about learning styles. When we give patients a handout, we're reading from it and talking to them, so we're also doing verbal instruction as well as written instruction that they can read. And if appropriate, we want them to use hands-on skills, whether that is pointing to foods that they like, whether it is having them make a list of things, whether it is demonstrating a skill. And then their readiness. How ready do you feel to go out and do these things? What are some things that you think are barriers that may prevent you from being successful? How confident do you feel that you're going to be able to carry this out? Part of confidence is making manageable goals. So when we're setting goals and we're talking to patients about achieving things, let's talk about short-term goals to get to bigger goals. Culture and religion. So think about everything that goes into what's important to us, our values. It's about the things we've learned as we've grown up. It's about things that respect what's important to me. So how do I know what's important to them? Maybe I should ask them. How healthy do you feel? So tell me what kinds of things make you feel that you are healthy or that you're not healthy. What are some things that you feel are barriers or that prevent you from eating healthy, that prevent you from getting enough sleep, that prevent you from stopping smoking? Okay, I want them to talk as much as I'm talking, right? Or maybe even more. Different cultural religious practices. Instead of saying these are the things you need to eat, tell me about the kind of foods that you eat, that you like to eat, that you cook. Do you have any dietary restrictions? Are there certain kinds of food that you don't like, or you don't eat, or you don't cook? Okay. Um, it could be religious practices. If we're talking to them about going out on the weekend and walking or whatever, and our patient expresses to us that I think Sunday is a day of rest or Saturday is a day of rest, and I don't do those things on that day. Okay, great. I'm glad you shared that with me. So let's talk about what you can do on the other days. Okay, is there a certain diet that is according to your practice? Is it important to you that you have a male or female physician? Um, what are some of the barriers that you feel like are preventing you from being healthy? And do you have any special cultural, religious beliefs or practices that you feel that would be helpful for me to know? And those all go back to their values and their beliefs. If they don't think something is important, or if other things in their life or their values are more important, we need to know about those values. Disability. So thinking about all the things that you need to have and utilize to understand me talking to you right now. It is helpful if you can see the PowerPoint. It's helpful if you can hear me talking and you can understand the language I'm using. If you, excuse me, feel well enough to listen, okay? If you're sick or you don't feel well, those priorities are going to come over you listening to me talk about things. Maybe our patient has difficulty with reading, okay? So maybe we need to define certain words or use other words that they would understand, asking them to define words. So you don't call, I call it nutrition as far as eating what is beneficial to improving your health. Tell me what you think. And as patients are talking to us, we can start to understand the language and the words that they're using. So factors again that affect their literacy, the amount of information, the kind of information they know and is important to them, and how they are able to learn and understand what I'm talking about and what things I need to know to teach them. Okay. Think about timing. So we said patients that come into the hospital, if they're in pain or if they're nauseous or if they are anxious or scared, we need to talk about those things first. So talking about those things first would help them to be able to be in a position where we've medicated them for pain. Maybe they're not feeling pain right now, or we've talked about um, why they're upset about not feeling like they can be confident in doing things. What kinds of things are making it difficult, okay? And then we want to use evidence-based resources. Again, those resources that come from government or educational sources, and it could be those sources that our facility has utilized. I know at my facility where I worked, we had an icon that was on our desktop computer, and it was for Mosby's skills. So if I wanted to teach somebody how to perform a skill, I could print that off. And Lippincott, it could be patient teaching information. Those were the sources we were to use because they were written at the educational level for that patient education. So evidence-based practice. We want patients to have an active involvement in their care. So we want it to be patient-centered. So you tell me about the things that are important to you as far as your health. You tell me what information, when you see this lab work, what do you think? Okay. You tell me what you understand about the numbers on your blood glucose, and then I will talk about kind of information that you don't understand. Okay. Is it easy to understand? Am I speaking in a clear voice? Can you hear me? Okay. Do you understand how I'm speaking? We tend to get in a hurry sometimes, and so our speech becomes more rapid. Maybe I'm speaking too quickly. Maybe I'm speaking too low. Maybe I am speaking in terms they don't understand. Okay, so always giving small pieces of information and then verifying, did they understand what I was talking about? Can you tell me what was the most important part of that, or if there were parts of that you didn't understand? And then asking them for questions. It should be reassessed after 2 or 3 key points. So if I had 5 or 6 things to teach them, I didn't want to go through all 5 or 6 things and then say, do you understand that? One particular, that is a yes or no question, and patients many times will say no because they don't want to appear that they don't understand, or maybe they are overwhelmed and don't even know what to ask. So if I gave you 2 pieces of information and then I said, can you tell me, kind of what was important about that, or what you understood about that in your own words, and then make sure that we clarify any terms they didn't understand. Are they engaged? Are they looking at us? Are they listening to us? Are they paying attention? If not, we need to assess why. Is information taught at a previous session? Can it be reviewed? So when we document that we taught patients things, we want to document what we taught, what we taught the patient, how we know that the patient understood, so how do we evaluate that, and exactly what information we taught them. So that if I come on after you, or let's say that it's a follow-up appointment and the patient was in our office a month ago and I'm seeing them again, I can look back at the notes and say, okay, and last time we talked about the importance of, understanding your lab work. So let's look at your lab work again, and you can tell me what the information means and how you interpret that information. So we can build on information we've already talked about. We also want to use the teach back approach. And so this is kind of what I've been talking about. So teach back means if you've taught them certain information, the next step is having them teach it back to you. Or we can put it in words like, so now that we've gone over how to check your blood glucose, can you tell me, or can you teach me in your own words the steps that we just talked about? I also like to say, okay, so when you go home or when you talk to your family, how are you going to tell them, or what are you going to tell them that we talked about today? That helps to see what were the most important pieces that we've talked about. So going back to our case study, before the nurse meets with the patient, she decides to read about the Bosnian culture. Among other things, she learns that many Bosnians tend to have strong ties with their families and communities. You know, this is similar to a lot of families in central Kentucky. And so we know that we aren't teaching patients in isolation. We're teaching them about diet. Many times that they're not only cooking for themselves, they're cooking for their whole family, right? We're talking about exercise. Can their family participate in that with them? And we know they do talk to their friends and family about their health and get input from their family. So we want to also be asking them about information. Is there someone that helps you at home? Do you cook for other people in the home? Is there anyone else that exercises with you or that could exercise with you? So patients don't operate in isolation. They have people around them that are very important as well. And that's a great support system for patients. So when Ashley speaks to the patient about her community, whether that is family or friends or community organizations, she learns that she's very close to her children and her neighbors. So how can Ashley tailor her plan for this patient based on that information? Great. I would, again, incorporate that by asking, what types of, if we're talking about diet and food, so what types of occasions do you revolve around food for you? Is it just the meals that you eat at home? Is it going out to eat socially with your friends or neighbors? Is it having like a community dinner or social dinner? And also talking about, is that helpful for you to be able to eat the things you like? You can kind of make things that you like that are within your diet to take and share with people. Or do you find that those are times that are difficult for you to kind of stick to the things that you should be eating? And if that's the case, talking about can they or should they eat other things outside of that meal in smaller quantities? So really asking them about, how does this piece of information or how does this piece of your life affect other parts of your life, and who can help you with those kind of things? Patient behavior. So how do we know if patients either don't understand the information we're talking about, don't feel confident in the information we're talking about, or may have some type of barriers that we need to talk to them about? Patient asking the healthcare provider to read information for them. They may say, "I'll have my glasses at home." But truly, is this a patient who can't read or write? And we can ask patients about that without making them feel inferior or sounding judgmental. Okay. So you left your glasses at home. Do you have trouble understanding any of this information, or do you have trouble understanding or reading information you have at home? So like reading prescription bottles or reading other health information. How well do you feel that you read or write? Okay. Asking them about their education. Okay, those are all things that are very important. And sometimes if we explain to them why we're asking information, so I'm asking you about being able to read and write adequately to read this information, or if your vision is giving you problems with reading information, because I want to be able to kind of facilitate that and be able to explain information in a way that's most helpful to you. Registration or other forms, so they're not completing forms that you've asked them to complete. Okay, maybe they don't understand the words, or they can't read that information, or maybe they can't write. Patient frequently misses appointments. Maybe they don't have a way of remembering appointments. Maybe they don't have a cell phone to get reminders, or they don't have a telephone number for that reminder to come with them. Okay, what are the barriers that are preventing them? Maybe they don't have transportation, or maybe at the last minute they realize that they didn't have the money to afford it, so they just didn't show up. Again, if they feel like that you are respectful of them and you're truly asking information to be able to help, that you're a friendly voice, patients will tell you things that they may feel embarrassed about, or that we truly may be able to help with. Making the assumption that the patient doesn't care and that's why they didn't come to that appointment is just going to cause us to give them some type of generic response like, it's important to remember your appointments, or you can be charged if you don't come to your appointments. Again, we're making a generalization. So instead of telling them the consequences of that behavior, let's talk about that behavior. Okay. Patient doesn't comply with medication regimen. Again, if they're not following instructions, we need to find out why. Patient does not follow through with lab tests, imaging tests, referrals. What is the why behind that? Instead of saying why puts people on the defense. Why didn't you do this? Why didn't you do that? We could simply use the word barriers. So what are the barriers, or what are the things that interfere with you making your appointments, or going to your laboratory tests? Are there some things that I may be able to help with? Okay. So what kind of questions should we ask? I want you to look at the language. Who will be taking care of you? We might also say, is there someone in the home that helps to prepare your medication, that helps to prepare meals, that does your shopping? Whom do we need to educate? Is there anyone else that you would like to join us while we have this information? If they are not there, maybe someone says, well, my wife does the cooking, or my wife gets my prescriptions. Great. Well, I want to talk to you about this information. And then I might evaluate and say, What are you going to tell your wife when you get home about the things that we talked about? What do you already know about your diagnosis or care of the condition? So tell me about checking your blood glucose. Do you have any history of caring for someone or knowing someone who's ever had to check their blood glucose? Have you ever watched a video about checking your blood glucose? How confident do you feel about checking your blood glucose? We're getting a baseline there. What is your preferred language? Okay. I can kind of build off of that when I say, um, um, what is your confidence with being able to read and write? Okay. What is the preferred language, or what language do you prefer to read information, to speak, or to learn information? What is the highest grade level you completed? Okay, that might be a generic question that we ask on assessments. And that's going to tell us as well if someone didn't graduate high school or make it to a certain level of their grade. A follow-up question to that may be, do you have any difficulty reading or writing? Again, that's a yes or no question. But again, if they said no, or even if they said yes, explaining why. I believe it's important to be able to give you information verbally and in writing at the level that you prefer and the language that you prefer. So at any time, if we're talking or we're looking at information, you have questions or you want me to explain something differently, please let me know. Okay. Again, we've given them facts, information, and kind of allowed them to ask questions. Can you read the local newspaper? Do you like to read books or magazines? This may be a question that is on some type of an admission history to the hospital or physician's office. And what it's really soliciting is from that patient, how much do they read? Okay, and that may have to do with their aptitude or their level of reading. What do you hope to learn from our teaching session? Great question. So instead of talking about diabetes from A to Z, they may say, well, what I would like to know is what are the supplies that I need? Okay. What do the numbers mean when I check my blood glucose? What are the sites that I should be using? What are some of the things that I need to know to stay safe so that I don't make a mistake? Answering particular questions can help us to focus where they value that information. What information do you feel is most important? That may be after we had a teaching session to evaluate what they understood and what was most important. Have you ever had instructions on this subject? Again, what is their baseline? Well, I've never been diabetic before, but my mom was diabetic and I used to help her check her glucose, and I know a little bit about insulin. I think I feel familiar with the hands-on part, but I'm not really sure about what's important as far as the information I'm supposed to get from it. How do you feel you learn best? We could do that. We could ask them that information. Do you learn best by reading information, by talking about it, by doing things, by watching videos? That can help us to hone in well about maybe resources we could give them after they go home. Well, there's a great video from the CDC, or there is a great website by the CDC, or I'm going to print off this information about your immunizations. Maybe they learn best in a group. There's a support group that talks about diabetes care. Do you have any difficulty with hearing or vision? Great question. Many times people do, and they just don't say anything because they don't think it's relative. They just think, well, I'll do the best I can. So even if they seem like they are hearing and understanding things, but they tell us, yeah, I do have trouble hearing in my left ear, so I listen more to my right, that could help us know kind of which side to sit on. It can also help us to say, maybe the patient says, well, I do have trouble hearing and I have hearing aids, but I don't have them in right now. Well, great, then we may need to really verify that they're understanding that information. Are you having any pain or discomfort? Great question again before we give information, to be able to say, is this a great time? And even if it's not, let's say that we don't have 3 days for this patient. Let's say that maybe they're in the physician's office and they're going home, and we do need to talk to them about their pain medication, but we want to make sure we're sending information home with them and giving them a phone number to call back as well. If the information that we're giving them, they have questions later because maybe they were distracted or they didn't remember all of it later. So with nursing diagnosis, what would be 3 nursing diagnoses related to health literacy and patient education? So what I want to talk about with nursing diagnoses is talking about knowledge deficit. Everybody has a knowledge deficit. So what are the things that a patient needs to know to safely care for themselves when they go home? Also talking about what's important to them. So we're going to look at that. Knowledge deficit or deficient knowledge. Self-administration of insulin related to a new onset of diabetes. Okay. It could be knowledge deficit related to how to take blood pressure medicine, related to change in medication. Could be knowledge deficit related to online resources for blood pressure, related to patient states. I'd like some more information about what are the normal ranges of blood sugar, or excuse me, blood pressure. Okay. Oops, a little too far, sorry. All right, collaborating. Think about all the people that we can collaborate, but collaboration is more than just getting together with people. It's also planning resources and it's delegating. So we could, it says assessment and development of a teaching plan may not be delegated. Remember, things can only be delegated to a UAP, a nursing tech, a nursing assistant, that are tasks that don't require knowledge or skills beyond their, training. They're not licensed, okay? And they don't have a nursing degree, so no teaching, okay? No evaluation of teaching. Now, that doesn't mean that the nursing assistant can't come back and say, the patient has a question about this. Or when I talk to the patient, it's like they're not hearing me or understanding me. That is a great information, and that elicits an assessment from the nurse. Collaboration. The patient is the center of care, right? We want to collaborate with them. We want to collaborate with any caregivers, okay? With the physician, okay? To make sure that the information that the patient is getting and understanding is the information that they need. If we don't know all the information that they need, or we don't understand some of the information that we should be teaching, maybe it's about the lab work. Maybe it's about how often they should do a dressing change, or what is their lifting restriction. We need to refer to the physician to get that information to know what to teach the patient appropriately. Social workers, discharge planners are great at coordinating community care, whether it be home health, follow-up appointments, making appointments, referrals to specialists, support groups, any of those types. And then physical occupation speech therapy, again, they're available to meet with patients that have needs, again, either in the hospital or on an outpatient basis. So they could get a referral through a home health agency with the help of social services or discharge planning, case management. Home care consideration, okay? What if you are the home health care nurse and you're going into the home? Remember that you're a guest. Be respectful of their time, be respectful of the environment, and be respectful of the people that are in the patient's home, okay? Less frequent visits than those in other settings. So you may be giving more teaching and more information at one sitting. Always make sure they have a phone number to contact you as the home health nurse, to contact the home health agency, and they know the phone number of their primary care physician if they have questions or concerns before you come back next time. If they have insurance coverage questions, again, helping them identify the website for their insurance company, the telephone number on the back of their insurance card, and if it is information in particular about home health services, that you can get them in touch with someone with billing or about their bill with your company, or if they have a question about the hospital bill, that maybe we help them to be able to find the number for account representative at the hospital, or if it's about the pharmacy, calling the pharmacy and maybe asking about how much the cost of a prescription is going to be. All of these things can be very helpful. Promote continuity. So document exactly what you did. At home health, you're going to have documentation as well. So whatever, even if we're in inpatient care or outpatient care, or even in the home, we're going to document what we taught, the information or the teaching that the patient has either taught us back they knew, questions they had, how they, things that were important to the patient, where you're going to pick up on teaching next time, how they're meeting their goals. All those things are important. So when we're implementing and evaluating, remember the 3 A's of health information. Okay? The health information that's provided to the patient or the caregiver should be accurate. Think about the sources that you're getting information. Is it appropriately accurate information? Is it about how much lifting they can do when they go home that the physician's written in his discharge summary? Is it about the types of medication they're going to be taking based on what the discharge instructions are? Is it about how to perform a dressing change based on instructions that are from the physician, as well as a printout from the appropriate teaching information that is educationally appropriate for your patient? Okay. Have we watched them repeat information back to us after we taught it? Have they demonstrated a skill? Have we asked them how confident they are? About any barriers that would prevent them from doing this? About if there's anybody that is going to help them? Accessible. So do they have accessibility to pick up their prescriptions, afford their prescriptions? Are they able to see the information? So can they see the small numbers on the syringe? Can they read the documentation we're giving them? And actionable, again, have we seen them perform the skill? How confident are they? And these are the things that they're going to need to perform the skill. Do they foresee any problems doing that? Some of the things that I just think of off the top of my head as I'm talking is patients that have a history of heart failure. They are very likely to become edematous, to retain fluid. And when they start retaining fluid, that's one of the symptoms that they're having problems. Their heart's not pumping well. So it's important for them to weigh themselves every day. So we can say, well, if they're going to do that, they need to have a scale. So I need to assess, do they have a scale at home, right? I also need to educate them with written information about what do those numbers mean. So if I weigh myself and I have not gained any weight, or maybe I've gained 1 pound in a day, and I'm not having any trouble breathing at rest, and I'm taking my medication, maybe that is where it's good. But maybe then I say, if you've gained 3 pounds in a day, and or you feel short of breath at rest, and or you're not taking your medication or have trouble getting your medication and taking it, you need to call the doctor and make an appointment to go to the doctor now. Maybe I say, if you've gained 5 pounds in one day, or you are very short of breath, then this is the time you need to call 911 or go to the emergency room. So what do I do with this information? That's what actionable means. Am I able to perform the skill? And do I understand what I'm supposed to do with this information? When we implement, think about the environment. Are we providing for privacy? Is it quiet enough? Is the patient not distracted by a loud TV or lots of visitors or pain or nausea? Think about the pace, okay? We tend to talk fast. We tend to do fast because we already know the information. Take time to slow down, take time to listen, and take time to always ask questions about the patient's ability to understand. So what do you already know about this? Okay. And then after we give some information, tell me in your own words what we just talked about as far as the supplies you need to check your glucose. And then after we've done that, how confident or how comfortable do you feel about doing this when you go home? Okay. Data integration. So with that, not only are we giving them information, but we're talking about what each piece of it means. So if I'm giving you information that says your blood glucose should be 70 to 110, if it is, I don't know, 111 to 140, use this insulin. If it is 141 to 160, use this amount of insulin. So what does that data mean? And are we explaining that so that they understand that? Okay. How do we do evaluation? I want you, when you think about evaluating a goal, okay, whether we are setting goals or evaluating goals, I want you to look at the verbs. And we say, and so let's think about some goals. Okay, so if we say our patient has a knowledge deficit related to checking their blood glucose using a blood glucose monitor related to a new diagnosis of diabetes, the goal may be patient will demonstrate correct use of blood glucose monitor and then maybe another goal, maybe that would be, if they demonstrated, that would be a psychomotor, that they could do something with their hands physically. Maybe we're thinking of a cognitive goal. Patient will state the steps to performing, the steps to checking their blood glucose once they go home. Maybe it's patient will state the supplies they need and the steps to performing blood glucose check, right? So they're going to state those things. They're going to restate them after we've taught them. So cognitively, we are assessing, did they understand that information enough to teach it back to me? Maybe it's an affective goal. Patient will state the importance of checking blood glucose 3 times a day as directed. Patient will state level of confidence in checking blood glucose after teaching session, right? So we could even say on a scale of 0 to 5, 0 being no confidence and 5 being the most confidence you've ever had, how do you feel on a scale of 0 to 5 about how confident you feel performing this skill after we've taught it and after you've just done it? Okay, we want to document all of that. That's going to show the evaluation of that goal. Could they do that? Did they state it was important? Did they state they were confident? Could they restate the steps to checking their glucose? Could they demonstrate that? It's a great idea to think about 3 goals for each nursing diagnosis. So we can have more than one goal. And so I want to challenge you when you're thinking about a nursing diagnosis, about a goal, okay, think about an affective goal, about their confidence, about the importance. Think about a psychomotor goal. Is it something they could demonstrate? And think about a cognitive goal, stating information, listing information, describing the actions of doing something. You should be able to do each of those for any goal that you have, okay? Ongoing evaluation is important, so it should occur by each member of the healthcare team. If I teach my patient how to use an incentive spirometer, like in the picture earlier, and they take a big deep breath and they let it out, it's expanding their lungs. I don't just want to teach them how to use the incentive spirometer and make sure I observe them doing that when on the first day of the hospital. I want to do that every shift. And I want to verify every time I go in there, are you using the incentive spirometer correctly? How many times an hour are you using it? How confident do you feel about it? I want to keep reinforcing that information. And each person along the way that is caring for that patient should also be doing the same thing, each nurse, okay? So we need to we need to pass on and report to our next nurse what we've taught that person and what how we've evaluated that, so they can keep teaching and evaluating based on that, okay? Teaching sessions include topics, skills, methods, materials, progress. We have to document that, and we'll be practicing. If you have any questions or concerns, please let me know. Again, be thinking about not only what we teach, but how we teach and things that may present barriers to teaching. Have a great day, and I will talk to you soon.